And hello, I'm Marthel Neville. Time now for Sunday House Call.
And hello, I'm Eric Sean. Welcome. Joining us, of course, two members of the Fox News Medical Aid team, as always. Today, from Southampton, New York, Dr. Marc Siegel, professor of medicine at NYU's Langone Medical Center and author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health.
And Dr. David Samadi, chairman and professor of urology at Lenox Hill Hospital and chief of robotic surgery. Good to see you both, Doc.
Good to see you.
Doctors, good to see you.
Great to see you.
Yeah, of course. You know, we're all talking about Muhammad Ali today on this Sunday as we mourn his loss. Perhaps we know his greatest fight was with Parkinson's disease, which he battled for the last 3 decades of his life, and so cruelly stole his grace, but it didn't diminish his courage, spirit, and humanity as he stood up to that disease. So, Dr. Siegel, let me start with you. What are the treatments now and the challenges about Parkinson's? And in facing it, you know, he exhibited this inspirational defiance, inspiring others. What's our progress against it?
Eric, you know, when he stood up there in 1996 and lit the Olympic torch, he was an inspiration to Parkinson's sufferers everywhere, because that's about overcoming chronic disease and standing up to that disease with 1 million sufferers of Parkinson's in the United States alone. You know, it's a very hard disease to treat. It can be very, very debilitating. For people out there, it could start with a simple tremor or even a loss of the sense of smell. And I want you to know it's a resting tremor. It's not when you're moving. It's literally when you're at rest. It starts with one side of the body over another. It look like you're trying to roll a pill. This is characteristic. You get very, very rigid, and your movement is very slow. Now, Eric, it's because of a loss of a chemical in the brain called dopamine. So the main treatment for it has always been to replace that dopamine. A drug called Sinemet we use. More recently, for severe cases, we're doing something called deep brain stimulation, where we literally can cut off the electrical signal to the part that's really causing the problem. Nerve growth factors are being looked at. They're years away. But the courage of being able to overcome and fight this, even with a mask-like face, Muhammad Ali, an inspiration to many, many people.
So, Dr.
And I
Samadi,
want to bring, Doctor, do you mind if I bring Dr. Samadi in? I wanted to ask, because Dr. Siegel did point out about the tremors. Is it always very obvious, the symptoms? And also, tell us, what does it do to the body, and is there any way to slow down Parkinson's disease, the effects of it?
Sure. I think that the symptoms could be actually very subtle at the beginning, and a lot of times you may not even know that this is there. But usually this is a chronic and it's also progressive disease, meaning that it gets worse with time. And early diagnosis obviously is the way to go because you can treat it. Now, why does this happen? We don't have a real blood test. We don't have a real imaging studies to diagnose Parkinson's. It's all based on clinical symptoms. Somebody that would have a shuffled gait, it's a typical walking shuffling gait, tremors that starts with one hand and can go to the other one, very stiff back, and they have maybe loss of balance, etc. That's, by definition, Parkinson's until proven otherwise. And as Mark mentioned, part of the midbrain doesn't produce that L-DOPA. Normally, Parkinson's, as Arthur, you were talking about, is diagnosed around the age of 60. He was diagnosed at the age of 42. Of course, I grew up watching Muhammad Ali as a kid. Not only he was a great champ, but also I think he defeated Parkinson's despite the fact that he went on for 30 years, and we'll see that he died from respiratory and sepsis. Now, brain is not meant to be punched at, and he basically took up over thousands of these very hard punches in early 70s, etc. What happens is, because there's no room in the brain, your brain would have a ripple factor and would hit the skull back and forth, depending on what part of the brain is damaged. If it's midbrain or substantia nigra, where the dopamine will come in, you may get Parkinson's. If it's frontal part, you may get behavioral problem. And obviously, you've heard of Alzheimer, which is all the scar and plaques that can form in the temporal area of the brain. So, you know, I think he probably should have quit earlier on when there were some symptoms. He continued to fight this, but what really got him is the same mechanism of these muscles not functioning in the body, same thing with his diaphragm, and I think he got some respiratory infection, couldn't get rid of it. You and I have the cough mechanism that will get rid of the infection and antibiotics. In him, the infection got to the system, became a septic shock, and unfortunately, we lost a champ and a hero.
Well, Mark, the rest of us, we're not boxers. You know, we haven't been susceptible to that. So what do we do? If you're young, I know someone who's about Muhammad Ali's age who has Parkinson's, and they live with it, and, you know, how do you deal with it?
Well, Eric, it's a great question, and the first point is, you know, that there's a 4 times greater chance of getting Parkinson if you have head trauma. Not just, you know, if you're a boxer and getting plummeted in the ring there, pummeled in the ring. I mean, he had signs of Parkinson even towards the end of his career, which is amazing that he kept fighting. But it increases your risk by 4 times. For most people, 10% of Parkinson's is not related to that trauma, and for those people, I would say get seen by a neurologist who is an expert at this, because they can test you to see if this rigidity is there. Those subtle signs can be seen by a top neurologist that understands which tremor is which. Don't stay with your primary care doctor. Go to a specialist. They'll put you on medication early, which may make your life a lot easier. And again, in the future, we're going to have new treatments for this. We need to shed a spotlight on this. Muhammad Ali also had a Parkinson Center in Phoenix. He raised awareness for this dreaded disease. It's really important that we keep doing that in his memory.
And that's a great point about the difference in tremors, because there are.
Right. And quickly, Dr. Samadi, I asked earlier, is there a way to slow it down?
Yes, of course, you should talk to your nutritionist. There are a lot of herbs that you can take that also, like tyrosine and other herbs that can mimic what dopamine is, because dopamine, you can build tolerance and you keep taking more and more of it. So definitely talking to an expert in centers of excellence for Parkinson's is the way to go. I also want to emphasize that this deep brain stimulation is a real entity, and for a lot of people who have tried everything else and it's failed, now we're making a huge difference by putting the actual fiber near midbrain, adjusting it with a pacemaker that patient has control over. Is a revolutionary system, and talk to your doctor about deep brain stimulation is a real entity. I'm glad you brought it up.
Thank you.
Thank you so much.
Very much. Okay.